thank you to the more than 20,600 people who were tested to 8 p.m. last night in New South Wales. That was a nice jump from the 14,000 we'd reported yesterday, but both Dr. Chant, the Minister, and myself can't emphasise enough the importance of getting tested. Please come forward if you have the mildest of symptoms, as we are definitely in the mopping up stage of the recent outbreaks that we had here in New South Wales. Pleasingly, overnight there was just one case of community transmission. It was a child which was a household contact of existing cases. And pleasingly, I can also confirm that the Mount Druitt couple we spoke about yesterday have been linked directly to the Berejiklian cluster. We have to yet determine the crossover point or the source of the infection, but the genomic sequencing has indicated that they are part of the Berejiklian cluster, and Dr. Chant will provide information on that front. What is really important for all of us in New South Wales is to be on the high alert that we have been in the last few weeks. We are definitely in the mop-up stage, but we don't want to see any what we call superseding events. We don't want to see super spreading events. We don't want to have an occasion where someone who may not know they have the virus unintentionally passes it on to a large number of people, and that's the biggest risk we face in New South Wales at the moment. The health experts are doing a great job in containing the existing outbreaks and getting on top of the cases that we're identifying, but what is really critical for us is to make sure that in New South Wales we don't have any of those events which cause a major spreading event, which initiated the Avalon cluster and then subsequent clusters. Again, a big thank you to all those who came forward and got tested. Please keep that up, even with the mildest of symptoms, no matter where you are in the state, especially if you're from Western Sydney and South Western Sydney and those suburbs that have been identified or venues have been listed on the website. Please make sure you do that. And can I also make a statement about vaccines? In the next few weeks and months, there'll be a lot of conversation about vaccine rollouts, about which vaccine is effective, who's getting it, etc. But whilst that process is unfolding, and I encourage people to strongly consider taking the vaccine, I certainly will be taking it when it's made available. To me. But I do want to stress that whilst those conversations are occurring, once the vaccine rollout is occurring, we still need to be COVID safe. Just because some people in the community, whether it's a small number or a larger number, have the vaccine does not mean that the rest of us can relax. Quite the opposite. All of us have to maintain our COVID safe lifestyle, which is why New South Wales has taken the continuing approach of keeping the virus at bay, but also making sure that we keep our economy strong, we keep our economy open, we keep people in jobs, and we also make sure that the well-being and mental health of our citizens is taken into consideration as well. And I just wanted to make that point clear, because once the vaccine begins to start rolling out, it does not mean we stop being COVID safe. We have to stay COVID safe for a while longer until the pandemic can be deemed to be over. We don't know when that end date is, but we have to learn to live with the virus, which is what we're doing. And I believe in New South Wales we're striking the right balance. And I want to also make this point. We don't want any of our citizens to have to bear any additional burdens or stress one day longer than they need to. If the health advice to me and the government is that we can ease restrictions, we can reduce some of the restrictions we've put in place, we will do that. But until such time that we've mopped up the current outbreaks, I think everybody appreciates what we're doing, and I want to thank everybody for their support and cooperation on this journey, and stress again that the best way that we can as a community fight the virus and keep our freedoms and keep the economy and jobs going is to get tested and to follow the health advice once we're tested, which is absolutely critical. I'll now ask Dr. Chant to give her report, and then we'll move on to questions. Thank you.
So New South Wales recorded one new locally acquired case of COVID-19 in the 24 hours to 8 p.m. last night. 6 cases were also recorded in returned overseas travellers, bringing the total number of COVID cases in New South Wales to 4,852. One of the 7 new cases reported at 8 p.m. last night, one was the locally acquired case. It's linked to the Berejiklian cluster and is a close contact of a previously reported case. And as I indicated again, that there were 6 cases in returned travellers. Our testing levels were sitting at 20,664 tests reported to 8 p.m. last night, and that has seen an increase on the previous day of around 14,700 tests. It is critical that we achieve over that 20,000 mark, and I'm particularly urging people in the greater Western Sydney area. So that picks up all of southwestern Sydney, those local government areas of Liverpool, Fairfield, Bankstown, as well as into the suburbs in Western Sydney. It is critical that we have those high rates of testing to ensure that we've tracked down any unrecognised chains of transmission. There was one venue that was added of concern. A public health alert was issued last night, and so anyone who attended the following venue at the listed time is considered a casual contact. If they could please get tested immediately and isolate until a negative result is received, and that's the Groomsman Barbershop at Warriewood Square, 12 Jackson Road, Warriewood, on Wednesday the 6th of January between 11:30am and 12pm. I again urge you to check the New South Wales Government website regularly. We do upload venues of concern and that information is updated, so please do check that frequently. In terms of the Mount Druitt COVID case that was discussed at the press conference a few days ago, results of the genomic testing on the case diagnosed with COVID after presenting to the emergency department on Saturday were received yesterday, and the results have shown that this case is linked to the Berala cluster. But despite the fact that we have that genomic linkage with the Berala cluster, we have not identified a point where that person crossed over with anyone known to have COVID. So it means that we are currently testing widely around what we call upstream contacts, a broad net to attempt to find any missing link in those chains of transmission. So I just want to extend my appreciation to that person and their extended family, and also other settings where we're doing that upstream contact tracing. It is important that we continue to practice COVID-safe practices. As the Premier has indicated, we don't want any super spreading events at this time, and it is a time where we are mopping up any stray chains of transmission in the community. So please continue to come forward for testing, and please follow those COVID-safe practices.
I'd just like to thank the community for using the QR codes that are now readily available at Service New South Wales QR codes through many shops, retail facilities, of course cafes and restaurants. But I want to emphasise this. In some locations it's obvious that the QR code facilities are there, but some people are not using them when they walk into those facilities. Can I just implore the community to use the QR codes, the Service New South Wales QR code? QR codes are the weapon that we as citizens have to fight this terrible virus. And so when you do walk into any shop, any facility that has a Service New South Wales QR code, don't wait to be asked to use it. Step up and use it. In doing that, you are making a huge difference to our tracers. The health tracers are working 24 hours a day, and you can actually provide them the weapons to beat this virus. We really do need to have you actually making sure that every time you walk in a shop, every time you walk into any facility that has a Service New South Wales QR code, you step up and use it. Thank you.
Minister, what are your comments based on regarding the fact that some people are not signing in?
There have been reports that in some cases there are QR codes available in shops, in retail facilities, particularly takeaways, and they aren't perhaps being used as frequently as they could be used. Simply engaging and asking the community to realise the importance of the QR codes. I think QR codes really are a weapon that we can all use to beat back this virus. We just need people to realise that it takes that few seconds just to stop. You see it sitting on the table as you walk into the shop, use it. Just put your camera there and make sure that you sign in.
Minister, can you explain, do we need to be signing in with the QR code system in retail shops, because that's not required under the public health?
No, what I'm saying is, if the shops have gone to the trouble and the retail facilities have gone to the trouble of having a Service New South Wales code, please use it.
Clarify once again the issue of the need or not for referrals from GPs or private testing clinics.
Are you talking about COVID testing facilities? Yeah, okay. There are obviously state-run New South Wales pathology services, and there are private services that the state government has purchased. Every single COVID test should be free. But if you choose to go to your GP, the GP might give you a referral to a separate private clinic. That is something between you and your GP, but it's not necessary. And so every citizen in New South Wales should know you don't need to go and get a referral from your GP. You can literally just arrive at a COVID clinic and have your swab done, and it will cost you absolutely nothing.
May I ask, the issue with Queensland, we've obviously seen 6 cases now linked with that UK variant of the strain. Is there concern that might spread south with our borders still remaining open?
Look, I just think we need to assume that these variant strains are going to become the dominant strain. And whilst we have outstanding quarantine systems in Australia throughout most of the states, we can't be assured that that strain won't seep out into the community, and that's why I strongly welcome the pause that we'll be taking in the number of people we're welcoming back home for the next month. So from January 15th to February 15th, New South Wales will be halving the number of people that come down. New South Wales has a much higher tolerance in relation to border matters than other states. We have confidence in our system. If there is a concern about a particular geographic region and around Australia, we've still maintained all of our borders, but we just have extra rules in place for when people come to New South Wales from those areas. And I have confidence in the health system in New South Wales. I also believe very strongly in dealing with our citizens compassionately, and that's why we have the position we do have on borders. If you recall, Victoria was up at around 120, 180 cases, I think, before we closed the border there. We're nowhere near that now, anywhere in Australia. And I think we need to have a very open and compassionate approach to those border issues, especially on the eastern seaboard, where so many border communities exist. There's so much interaction between our communities. I mean, I'd like to see better border arrangements across Australia, of course, but there are particular spots where people are more impacted than others, and New South Wales remains to have a very high threshold on these issues. We believe in open borders unless absolutely necessary to take action otherwise, because we don't want to see people affected, and we're lucky now that it's still school holidays. Could you imagine the chaos of border closures and border restrictions when school's on and kids and teachers and parents have to go across borders for education purposes and also for work purposes? I guess as Australia Day approaches and most people are thinking about getting back to work, most people may have interstate arrangements. Many people would have interstate arrangements in relation to their business or jobs, and all of that needs to be taken into consideration. There's no other option. I'm not sure, Liz, what you're getting at, but that is the safest thing to do. Of course we need a strong hotel quarantine system. And pleasingly, New South Wales always gets a tick of approval when our systems are audited. If we need to do better, we will. If there's things that we're not doing we should be doing, we will. But there's no doubt that our hotel quarantine system is what's protected our community from the virus. It's what's allowed us, because other countries don't have the system we have. They have free movement across borders, which is why the infection has spread rapidly in many other countries. The hotel quarantine system is what has protected our citizens, and it's critical to maintain that. But I certainly wouldn't want to see a relaxation of that, especially now when we're coming to terms with learning about what the variants are doing. I hope that answers your question.
Dr. Chant.
Can I ask in relation to the man who presented with Mount Druitt Hospital? He's been genomically linked to the Berejiklian cluster, but you haven't identified any potential chains of transmission. Does that concern you that there might be undetected chains of transmission in that area of Sydney?
Certainly one of the key issues is whether cases are linked. If we cannot readily link a case with a direct crossover with an infectious case it means we are potentially missing chains of transmission. And that is why at the moment we are doing a lot of upstream, what we call upstream contact tracing, and that's looking at who could have infected this person. That will then hopefully give us some other lines of inquiry where we might then find a crossover of that person to known cases or contacts. But obviously I'm very concerned that we might have chains of transmission which are unrecognised, and it is critical that the community comes forward for testing. That is the one thing that we need to do to give us that assurance that we are not missing those chains of transmission. In addition, we're monitoring closely our sewage surveillance system, and overnight we've also had a detection at the West Hornsby treatment plant, and this catchment takes in Glenorrey, Wahroonga, Thornlea, Pennant Hills, Cherrybrook, Castle Hill, Galston, Dural, Westlea, Glenhaven, Waitara, Hornsby and Normanhurst and West Pennant Hills. We are aware of some cases in that catchment, but as a precaution we again draw this to the attention of the community and ask you again to just reflect on it. If you have the most minimal of symptoms, please get a test as we're going through this very critical phase in our response.
Dr. Shah, in relation to the UK strain,
how severe is the strain? We know it's a different strain, but has the severity been proven? Because the correlation between the seasons and us being in summer and the UK being in winter, how much does that play into it?
There's a few different concepts with the virus. So there's whether it's more readily transmittable. And what that means is if one person has the virus, how many people on average are they able to infect? And we think that this virus is more transmissible. We don't have any information that it's more severe or that the infection is longer in terms of your infectious period. But obviously we are learning all the time, and you'd expect us to take a precautionary approach, and that's why we've also, when you're diagnosed with this strain, we're putting in additional periods in isolation and additional expert review prior to you being released. So we are concerned by the increased transmissibility, but you're correct. We know that there's factors around the virus and its transmissibility, but then there's also the behaviours and the settings. We know that indoor settings where you're crowded inside, and particularly in household or small indoor venues, you are going to encourage the virus to be more readily transmitted, including whether you're singing and drinking and some of those interactions that might or speaking loudly. These are all some of the contextual factors that lead to an increase in transmission. So I think you're correct. The virus is clearly contributing to the increased number of cases in UK, but there are also other contextual factors about where the UK is in the middle of winter and some of the behaviours and settings there.
The adequacy of the Astra vaccine today from epidemiologists. Are you concerned about that debate in terms of generating a lack of confidence ultimately in that vaccine?
Australia has an incredible track record with vaccine rollout. We've got a very strong regulator in terms of the Therapeutic Goods Administration, and I think we need to be very pleased that we've got access to vaccines, but we've also got to let the regulator do their job in evaluating all of the information and determining the registration status of the vaccines. And then I'm confident that we can roll out a safe and effective program, and I have great trust in our regulator.
How long will we be popping up periodically for these two outbreaks, the Avalon outbreak and the Berejiklian outbreak, in your view?
In my view, it will take at least 3, maybe 4 weeks, and so I need the community to be on track with us. But the more we can adopt those COVID-safe practices, those practices of wearing masks indoors, getting tested as soon as possible with the most minimal of symptoms, maintain that physical distancing, this will all mean that even if we don't recognise a case, it's less likely to transmit to multiple people. And that's what we're really trying to do, is stop any further superseding events and see this virus diminish and get to no community transmission.
Should we take from that there'll be really no easing of restrictions over the next 3 to 4 weeks? So you want...
Health continues to monitor the situation, so I'm giving you my honest assessment of the fact that As an epidemiologist, we like to see, around 2 incubation periods before we assess that we are free of the disease. But however, the greater testing rates, the work of our contact tracers in making those links, there's multiple factors we take into account in assessing it. But I just urge everyone, please do not become complacent with the lower numbers. It's almost a time to redouble our efforts as we try and get to know community transmission as soon as possible.
Yeah, now that we have...
Patient is not the patient associated with Mount Druitt, and I'd have to just get you an update. That patient may well have been taken off a ventilator. That person has had a long course of illness and dates back to July, but conditions obviously change. But we have one patient that is in ICU at the moment, but obviously that changes from time to time.
These Dr. Chant, if they caught it in July and they're still going in and out of the ICU.
People, this is why we cannot be complacent around COVID. We know particularly the elderly, particularly those with underlying health conditions, but it can hit all age groups very severely. And for some, they do have debilitating impacts on their respiratory, their lungs, and that leads to vulnerability even after they've recovered from the COVID diagnosis. And that's why we can't be complacent, and that's why I'm urging everyone in the community to please come out in force and get tested, but also play your part in, if you don't have symptoms, in making sure that you're physically distancing. You're making sure that when you're going to family gatherings, you're really messaging to anyone, don't come to those family gatherings if you've got them symptoms. Please stay away and get tested. We all have a part to play, and I'm very, proud of the community in the way they've responded to our calls for testing, but we need to sustain it.
The Queensland Premier seems to have indicated that she wanted to speak to the other premiers, as Liz was saying, about hotel quarantine. It's not clear that she has elaborated exactly what she wants to speak to you about. Would you support, for instance, I don't know whether she's going to suggest that we don't take anybody coming in. We've obviously seen the cut in the number of international arrivals. Would you support that being reduced further, or would you support Queensland perhaps taking even fewer at the moment as a result of what's going on there?
At the end of the day, these are decisions that the Commonwealth Government has to actually take. We can't control what the overall cap is that the government wants to receive into Australia. But I'll say this, that whilst there's always a risk when you're returning Australians back to our shores, it would be, I think, a terrible blow if we stopped any Australians coming back home. I don't want to see that. I think it's a blow from a human compassionate perspective, but also from an economic perspective, because every plane load that brings people to our ports also brings urgent freight that we need, important freight that we need. And it also means that the hospitality and tourism sectors can have something to look forward to during and post-COVID as well, and how we manage those issues. So whilst, of course, there's a risk every time you bring Australian citizens back home, I think it's unfair and unrealistic to suggest that we're just going to completely close our borders to Australians. I don't think that works. But the federal government, the Commonwealth Government, has made very clear their priority is to welcome back Australians at this stage, and Australians only, and that's what the policy has been. And New South Wales has accepted that, even though we put forward, policies beforehand about other categories of people being able to arrive on our shores. But I completely support the pause. Having halved our rate for a month will take enormous pressure off our system. It will allow people to have a bit of a breather. We've had health officials, police and other agencies, Service New South Wales, involved in this process for a long time, and I'm looking forward that they'll get a breather, that we'll also be able to use that time to assess what the variants of the disease are doing, and we have to assume that these more transmissible variants of the disease are going to become the dominant disease, so that every single person in quarantine who has the virus is likely to have these diseases, which is why yesterday we made clear that if you do have one of these new variants, that you will the clock starts ticking for your hotel quarantine the day your symptoms materialise, not the day that you're in quarantine. And that's an extra safety measure we've put in place. So I think it's important to use this time to learn. And if it means we need to tighten up what we're doing around hotel quarantine, well, this is a good time for us to make those evaluations. It gives us some time to do that.
Now that Dr. Chant has said that it's her assessment that it will take 3 to 4 weeks to mop up the latest clusters, if everything goes well in that 3 to 4 weeks with low case numbers and high testing rates, will you look at easing restrictions, going back to some of the rules we had in place in mid-December in 3 to 4 weeks when we have mopped up these clusters?
We've always said in New South Wales, and we adhere to this policy, that we don't want our citizens to bear any extra stress a day longer than they need to. If the health advice suggests that it's now safe at a particular time to ease on some of the restrictions we have, of course we'll do that. But it's dependent on the settings and what we're worried about. As we move through the pandemic, we're learning more and more what those high-risk settings are. We know where those high-risk settings are. We know what type of activity leads to those super spreading events. And there's no doubt that for a period of time we had no cases of community transmission in New South Wales. It was a good place to be, but it only took literally one super spreading event to have that change. And we know what the risks are associated with that. We know in particular, unfortunately, mingling, singing, dancing in indoor areas are all high-risk activities, and those settings we have in place are there for a reason. But we also want people to feel confident enough to go about, as they should, to go about their daily business. If you don't have any symptoms, if you're not feeling unwell, you should feel free to live in a COVID-safe way, to undertake your job, to undertake your education, whatever you normally do, in a COVID-safe way. And I do want people in New South Wales to have that degree of confidence. We wouldn't allow you to do things unless we thought it was absolutely safe. So going to work, getting educated, doing those day-to-day things, enjoying the freedoms we have is all part of our setting.
Just on that number that Queensland takes. Okay, just on the number that the returning Australians, just to Ursula's question, if Anastasia Palaszczuk does come out and say we can't deal with the UK strain or how many cases are cropping up, and she does try and get a reduction, and that would therefore increase the burden on other states like New South Wales, what would your stance be then?
Look, I don't want to speculate on what may or may not be said by another Premier, but I'll make this point, that we've always argued that New South Wales should do its fair share. Unfortunately, we've had to bear more of the responsibility in recent months. Melbourne, Victoria was out of action for a long time, so we took on that extra load. But I'd like to see, there's no reason why every state can't wear their share of the load. We're in this together. And I would like to see some model post February 15, which is based on your population size or based on such matters. But we also have to accept, and Melburnians might have something to say about this, but Sydney is Australia's truly global city, and we have a responsibility to the nation in relation to those matters as well. But it's always a fine balance of being safe, but also making sure that we undertake our share of the load.
On weddings specifically, they're capped at 100 in the Greater Sydney area, but wedding operators say that people in Sydney are going into regional New South Wales where weddings are uncapped under the 1 per 2 square metre rule to have their celebration. It doesn't seem to make much sense. It doesn't make much sense, Premier, that you can't have Sydney-siders can't have a wedding in Sydney of more than 100 people, but the same people can go into regional New South Wales and have a larger celebration in the regions.
Well, obviously, it's always concerning for us when we have to set decision-making around weddings, because normally they're planned for a long period ahead of when they're occurring. And all those considerations, those policy issues are taken into consideration, but the rules are what they are, and we just ask people to exhibit common sense amongst those rules. And even if you are in a regional community which does allow you to have larger numbers, please know that singing, dancing, all those activities are high risk, and all those activities can lead to a super spreading event. And I don't think anybody wants to see those closest to them succumb to the virus.
Of the different states, the different territories, what they consider to be hotspots. I noted yesterday Northern Territory had 11, ACT has identified 12, we've got Queensland saying the whole of Greater Sydney, we've got, I think Victoria says the same thing. It is very confusing for people. Is National Cabinet going to come up with a better definition of hotspots? Or what's happening with that, and why is there so much difference?
I would love to be able to rely on the health advice for that hotspot, but unfortunately the states weren't willing to accept that health advice, because that would mean that there'd be nowhere in New South Wales that was a hotspot at the moment. So obviously some states want the threshold to be higher than what the health advice is recommending, but we've always followed the health advice and we'll continue to do that. But the health advice, unfortunately, there hasn't been national agreement on what a hotspot should determine. So I just say to citizens, please listen at this stage to your state authorities on what the rules and restrictions are in place. Please make sure if you're a citizen of New South Wales, you're looking up newsouthwales.gov.au every day if you're concerned about venues or want information. And I would like in due course to see a national approach agreed to in relation to how that's defined, because that will give everybody certainty. But unfortunately, some states have a lower threshold than others on how they define it. For example, can I just say this? For example, one case in South Australia didn't move to a hotspot for the South Wales state. Other states did. And that's, I think, what's causing some confusion.
When they make announcements, a lot of the chief medical officers of those states or territories get up and explain, so it is based on their health advice. So why is the health advice then so different state to state?
Well, I guess every state may have unique circumstances that apply to it, but it's also really a mark of the settings you have in place. So, for example, if you have your borders closed, that means your citizens can do things that citizens in other states can't. So that setting in itself, makes you have a different policy to other states. And I think that's where things can differ. So, for example, how you relate to a hotspot might be related to how you deal with an outbreak of a case. In New South Wales, we have the confidence to rely on our contact tracers. We have the confidence to rely on our health people.
On Australia Day, Premier, there's a concern that some councils may use COVID to, for political reasons, really restrict what Australia Day ends up being. Would you be concerned about that? What kind of Australia Day do you want to see on 26?
In Australia Day, can I just take 1 second? I want to see an Australia Day where all of us come together. It's what we feel on the day that matters. And I think we can all celebrate the day in a COVID-safe way.
Are you happy with your cabinet at the moment, and will you be looking to make any changes?
I'm focused on the citizens of the state.
iCare, just on iCare, PricewaterhouseCoopers, they were paid $900,000 to do a review into the iCare. Is that money well spent?
Sorry, I have to take that on notice. I wasn't sure about that, yeah.
Question about contact tracing. What qualifications do you need to be a contact tracer in New South Wales? And do you think that people should, if there are specific qualifications, does New South Wales Health want more people to train up to be a contact tracer, just in general?
I think it's really important to understand that there's probably a few components of the work that is doing the work of contact tracing and disease investigation. I'd put it in a global sense. The first thing is that you need access to great pathology and you need great access to great expertise. It may sound simple, but it's actually even hard to pinpoint when a person has onset of symptoms. Sometimes is it an older infection, because people will have often a couple of different times. They might have felt fatigued at a particular time. So you need that laboratory testing to help you do antibody tests and other tests to actually determine the testing. And then we also test around them. So there's a multidisciplinary team, and I'd just like to say, yes, our contact tracers are fantastic, but it's actually the team, the laboratories, and the whole system that supports them. We do have call centres that do scripted calls when we find out that a whole venue is deemed as a close contact. But then there's those epidemiologists and public health practitioners who make some of those calls and assessments with our infectious disease and laboratory colleagues. I know it sounds simple, but it's actually quite a complex in some settings. And we need that full suite of skill set to do it well, and I'm very proud of the fact that our pathology services, do tests out of hours, stand up and do those urgent things where it's critical piece of information that helps us determine whether someone's a late infection or an early infection.